Hello, and thank you for joining today's webinar. We are ready to begin. Today's webinar is eligible for 1 contact hour. Sigma Theta Tau International Honor Society of Nursing is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Center's Commission on Accreditation. The speaker and planning committee members have disclosed no relevant financial relationships. To receive contact hours for this NCPD session, participants are required to attend the webinar and log in to our LMS system to complete the evaluation form. Information on how to access this will be emailed to all attendees approximately 1 week after the webinar. This webinar is being recorded and will be available via the Sigma repository within a few business days of recording. Following the presentation, we will have time for a question and answer session. You'll see on your GoToWebinar control panel that you can send a message through the questions feature. This is where you can type in any question you'd like to pose to the presenter. Be sure to hit send so the message makes it to us. We'd like to thank our speaker today for sharing her expertise with us. Our speaker is Dr. Cuevas. Dr. Cuevas is an Associate Professor V at Centro Escolar University in the Philippines, teaching in the School of Nursing and Graduate School. She graduated Doctor of Philosophy in Nursing at the University of Philippines, School of Nursing and Master of Science in Nursing, College of Nursing, passionate for lifelong learning. She is currently taking up Masters of Science in Medical Anthropology and on thesis writing at the University of Philippines College of Medicine. She was a fellow at the Cohort 5 at the Gerontology Nurse Leadership Academy, Sigma Theta Tau International Honor Society of Nursing, and an international visiting scholar at the Center for Global Initiative, Johns Hopkins University School of Nursing in Baltimore, Maryland, USA. She is also a distinguished educator in gerontology nursing by the National Hartford Center of Gerontological Nursing Excellence in 2020. Thank you so much for joining us today, and let's get started with the presentation.
Okay, thank you. Hello, everyone. Good evening, Philippines. Good morning in the United States, and good day all over the world. I would like to thank Sigma for inviting me in this webinar series. I am so excited to share with you the evolution of concepts in meaning-based nursing care. So for today, our learning outcomes include to provide a clearly constructed definition of the concepts that comprise the creation of meaning-based nursing care, to showcase concept evolution using concept maps leading to a framework for meaning-based nursing care, and to formulate meaning-based care approaches that can be prescribed in the nursing arena. Next slide, please. So to start with, have any of you heard about meaning-based nursing care? We've created a poll to know the level of knowledge of our attendees about meaning-based nursing care. So please answer the poll within 1 minute. We have 96 attendees, 97 attendees at present. So I think we can get a very good number as to how many of you have heard about meaning-based nursing care. These are the selections. Please select one. I know it and can do it with ease. I'm pretty knowledgeable about it. I'm okay with it, but struggle with certain parts of the concept. I think I might have heard it once or twice. I've never heard of it. Okay, so the poll results, single answer required, say that I know it and can do it with ease is 5%. I'm pretty knowledgeable about it is 4%. I'm okay with it but struggle with certain parts of it, 10%. I might have heard it once or twice, 25%, and 56% or more than half of our attendees have never heard of it. So I think it is safe to say that not many of our participants know about meaning based nursing care. So we're learning something new today. Wow. Next slide, please. The concept of meaning based nursing care is actually my PhD in nursing research coursework for the subjects theory validation and theory building. And since 2007, I've made several attempts on concept analysis related to meaning based care in my research projects, especially in the use of clients with pain and discomfort. This was also used in designing adult daycare program for older adults, and several of my publications included this concept of meaning-based nursing care, and this shall be cited in this presentation. You see, creating meaning-based nursing care is my academic passion, and I would like to share it with you through this presentation in the hope that you will also share my enthusiasm towards it. Next slide, please. So this is all original work. If you Google my name, you can see it. You can see all the work I've done related to this. And this presentation is based on my personal analysis of meaning-based care as its concepts are explained in various literatures. Next slide, please. So what is it that we mean when we say meaning? In one of my published articles, I said that meanings are guideposts for nursing practice. For example, when a nurse meets a patient for the first time, our first interaction is meaning laden. We look at our nonverbal cues more so with our verbal cues. If the patient tells you that she has a daughter who is also working as a nurse, she may mean that nurses are dear to her. If a patient shivers at the sight of an injection, it may mean fear of an upcoming procedure, and so on and so forth. Meanings have been defined as an idea a person intends to express, a way of communicating something of importance to that person. The term meaning based as a concept has not been fully explored in both clinical and research contexts, much less in relation to nursing care. Next slide, please. As a nurse or as nurses, we advocate for patients to feel better. If we can help them find meaning in symptoms or suffering to be able to overcome it, those will be small triumphs towards recovery. I first uh, took an interest in meaning when Viktor Frankl based his theory on logotherapy, or the premise that the goal of life was to find meaning. In this context, it is seen in the lens of nursing situations and encounters. Frankl believed that life holds potential meaning under any circumstance, even in suffering and upon symptom experience during illness. His theory centered on the concept that meaning existed in life, and Frankl believed life has a unique meaning for each person that can be found despite horrific situations. He affirmed that even the worst tragedies could be turned into triumphs if individuals choose to make it so by taking the opportunity to grow beyond themselves and to find meaning. Next slide, please. So, how are meanings constructed? The social theories relate to meaning making as a way for persons to understand the value of a situation that one is put into. Marx and Heidegger explicated that meanings were socially produced but situationally interpreted. And this led to the diverse theories of learning that were influential in meaning making. So every situation has value. And an example is that the nurse patient interaction have value with meanings attached to them by the dyad of the nurse and the patient. Next slide, please. So, how has meaning making in nursing evolved? Okay, It can be said that current understanding of meanings were enough to guide knowledge development regarding the nurse being meaning based in giving nursing care. But the process of understanding meaning based approaches in nursing care of pain and discomfort has been previously explicated from the lived experience of patients in various settings. And meanings was also used in adult daycare program managed by nurses for older persons to serve as guide in creating meaningful, focused, and structured activities for patients. So the reason for meaning making in this context is to establish concepts behind being meaning based to ensure that findings were not limited in transferability and can actually be prescribed as care in nursing situations. So we want to be able to use this information as an innovative tool to understand our patients better. Next slide, please. So how did it all start? I actually used the framework of Avant and Walker, which included the development of a clear definition of meaning, identifying antecedents, defining attributes and consequences of the concepts, and developing a model for empirical grounding. I looked at related studies to identify constructs important in research investigation, and other important literatures were explored to bring light to the logical thought process that has emerged from the data. Next slide, please. So the methodology that I used are literature searched, shortlisted listings from the internet with keywords, and this was limited to articles written in English language published in a 10-year period from 2009 to 2019. Next slide, please. So, what was the result of my investigation? An account of being meaning based was seen in a dynamic context influenced by the unpredictable nature of a patient's or a nurse's interpretations. So, meaning is laden on the person, either the nurse or the patient, and the diet that the interaction produces. Various concept maps have been presented to illustrate in schematic diagram the interrelationship between identifying antecedents, defining attributes, and the consequences of the concept. Next slide, please. So this is the first slide that I was able to make, the concept map on a clear definition of meaning. This actually attempts to define all concepts that interplay in meaning making. You see, when meanings are elicited, it starts with some logical thought behind it, followed by the definition of meaning, thread, and current thought. And lastly, it is attached with synonymous meanings. Next slide, please. So what is really in figure 1? Figure 1 shows the concept map on a clear definition of meaning which flows from antecedents to attributes and then consequences. So antecedents were the logic of meaning expressed linguistically with a noun or a verb or with a noun or an adjective. Nouns can be interpreted as ghosts that possess an inner significance for that person. The attributes include definitions of meaning, thread or current thought that one intends to do or achieve, which can be the gist of a specific action or situation. And as a consequence, synonyms of meaning surface in response to the use of words or gestures. All these nonverbal cues support the definition of meaning for a patient and must be considered in giving care that fits the individual. In this light, the concept definition of meaning based was further explored based on the historical concepts of logotherapy, a concept developed by Viktor Frankl, and based on the premise that the primary motivational force of an individual was to find life's meaning. Next slide, please. So, what are the antecedents? Um, According to Frankl, the demand for the quality of life that people deserve was what taught them its meaning. So logotherapy taught us that it was not people who asked life the whys, rather it was life who was the questioner of people. We begin to understand that life questions us in many situations to be able to find meaning in our journey to life. Next slide, please. So this is in the next slide, figure two, the concept map of identifying the key elements in concept development. There are three major elements that comprise this concept map. These are the tragic triad, the meaning triangle, and the two different meanings that are literature based, which I believe explicate the concept best. Next slide, please. So, what is really in figure two? It showed the concept map of identifying the key elements in concept development. This is when people have to respond to life's questions on them. Individuals answer to life by listening for discernment of the meaning of the moment, then by making responsible decisions within their available area of freedom. Now, Frankl argued that people always have the freedom to find meaning through meaningful attitudes, even in apparently meaningless situations. This points to three ways of the meaning triangle as creativity or giving something to the world through expressions, using your talents in various ways, life like the work we do, the gifts we give to life. Number two, experiencing or receiving from the world through nature, culture, relationships, interactions with others, and with our environment. And number three, a change in attitude. Even if we cannot change the situation or circumstance, we can still choose our attitude towards the condition. This is often a self transcending way of finding meaning, especially in unavoidable suffering. The way we, people, respond to the questions that life throws at us is the way we actually create meaning. Next slide, please. So, what are the two levels of meaning in life? There are two levels of meaning in life that Viktor Frankl talked of. These two um, different meanings are ultimate meaning and the meaning of the moment. The ultimate meaning was the meaning that people can never reach, but just a glimpse of the horizon. It can be God, but also science as the search for truth, nature, and evolution for those who do not believe in God. I was watching a movie the other day about Buddhism and the monks who search to find meaning in life. So that's they were searching for their ultimate meaning. But in pain and suffering, when we have patience, we look for the meaning of the moment. Why is this happening? The meaning of the moment was when people have all the time to answer the questions asked by life, and therefore it was important to understand the meaning of each moment by fulfilling the demand life placed upon us. No, actually, I was asking for the meaning of the moment for patients who had COVID. No, how was it like to not to be able to breathe, no, and not to be and to be uncertain of the future. The dynamism of life was faced with the elements of a tragic triad, and according to Frankl, these were unavoidable suffering, guilt, and death. But this was usually the best way to find meaning, especially in situations that people cannot change. Was the result we should result in a change of attitude. If we cannot change anything, then it should be within us that should create the change. A new meaning often dawned undergoing one or more of the triads. Next slide, please. And so, what are the attributes? Defining attributes were characteristic of the concept that appear repeatedly in literature, according to Appant and Walker. And existing theories and studies of meaning in various populations have defined key attributes to meaning that occur with life experiences. Another study, which is very important in this research, is that of Richer and Esser, who defined situational and extended meaning. existential meaning that can be attributed to meaning perception. Situational meaning is like meaning of the moment. It was the perception of a new event and the patient's capacity to handle it, while existential meaning is like the ultimate meaning, which were global representation of a person's place in the world, or in Quali, we call it as a being in the world. These concepts allow for possible nursing care that were meaning based to be used in the clinical setting. Next slide, please. So then, what are the other attributes that we can derive from this? In an attempt to further define being meaning based, the attributes of Frankel's search for meaning and meaning triangle was included. More so, or moreover, another attribute was Crumb's meaning or purpose in life, which was a list of 6 values, including lifelong aims, strong points of personality, weak points of personality, specific problems that cause clients conflict, future hopes, and future plans. You see, in medical anthropology, we look at every aspect that people find meaning in. Sometimes they define their health or their current situation based on good luck or bad luck. And these are their beliefs that actually affect their health, and each is a part of the attributes when we make interventions for them. Next slide, please. Next slide, please. Figure 3 is the third figure, which was derived from the study, the concept map of meaning based nursing care. Um, these are putting all the concepts together in my head. I was able to come up with this diagram producing meaning based nursing care, wherein meaning making started as antecedents, meaning perception as attributes, and meaning evocation as a consequence. Once evoked, meanings can be interpreted, analyzed, and understood. Thus, meaning based approaches may be formulated. So while this is playing in my head, I actually was able to do several researches asking patients what meaning based means for them and then asking nurses what meaning based means for them so that I can come up with a framework for meaning based nursing care. Next slide, please. So what is in figure 3? It shows the conceptual framework of meaning-based nursing care, which was based from the consolidated findings of several literatures and the formulation of meaning-based approaches, which resulted from being meaning-based in nursing situations. Meaning seems to have its roots to be about connections between individuals, between groups of individuals, and also within individuals in that it can be experienced powerfully as new or better links between previously disconnected internal bits of people. A powerful sensation, this was a reduction in personal fragmentation, the experience meaning as new or better connection between here to disparate ideas. As social beings, it is so important to create meanings um, for people, no, that we encounter or people that we give care to. And that is what meaning based approaches means. Next slide, please. So, what are the consequences? Um, the meaning based conceptual framework is actually a created framework, no, that could help define the consequences. Cognitive science provides an account of the nature of meaning that was necessary and sufficient to the resolution of differences between various schools of literary criticism. Simon claimed that to provide an explication of the nature of meaning, the nature or meaning of meaning and have given a description of important parameters that determine meaning evocation. So, in any given situation between the patient and the nurse, we evoke meaning. And this comprehensive account suggests that meaning was dependent on varying contexts and also often on the vagaries and idiosyncrasies of the intention of the patient or the nurse and the interpretation of both. Hence, it was a complicated process in which the notion of normative meaning was not particularly a reliable guide for predicting meaning evocation in a specific concept or context. Next slide, please. So, meaning evocation is actually a consequence of meaning making and meaning perception. The role of meaning interpretation in meaning evocation was a novel insight since ownership of text and an acceptable or normative interpretation cannot take place without at least an implicit acknowledgement that interpretation was dependent to varying degrees on the patient or the nurse. Carnap stated that meaning analysis was actually an examination of meaning to find out how it was made or how it works or what it was. This complex activity must be deciphered by the nurse in order to craft individual nursing care. And yes, meaning based care is actually individualized, tailor fit nursing care that is holistic in nature, that addresses the mind, body, and spirit of the nurse. And deciphering this process requires meaning understanding. And so it is a part of the role of the nurse to understand what the meaning of experiences are for patients. Next slide, please. So, meaning understanding evolves as the nurse aims to get the meaning of it, to know thoroughly, to have reason to believe, and to take as meaning of something not openly made known to the patient. Meaning was treated here not as an attribute of information, but as a crucial part of the human experience. As a component of belonging, sharing, understanding, perceiving, associating, finding relevance, feeling inclusion and trust, seeing value, engagement, attitude, belief, acceptance, receptiveness, expectation, and often attraction and desire. So that's one of the ways to understand meaning. Next slide, please. So this is actually the final conceptual framework that came out of all of the conceptual frameworks that was put together. The meaning-based care conceptual framework is a created framework to anchor the use of meaning-based care. Again, using concepts from the literatures as analyzed in the light of past and recent understanding of meaning. So here, everything is consolidated to form a meaningful whole. Next slide, please. So what is in figure 4? It showcased the framework that emerged that is reflective of the antecedents of meaning making, the attributes of meaning perception, and the consequence of meaning evocation, resulting to meaning-based care in meaning-based to being meaning-based in giving nursing care. Being meaning-based means to embody what we learned about meanings that when you're giving your nursing care. Okay, next slide, please. So the meaning-based conceptual framework showed that meaning making was the antecedents of the study, followed by meaning perception as the attribute, and lastly, the consequence of the study was meaning evocation. Meaning making as an antecedent included linguistic and non-linguistic aspects of meaning that occur either individually or together as patient and nurse. Linguistics included words, phrases, and sentences. The non-linguistic field included extra linguistics and natural meaning. Meaning perception as an attribute included the interconnectedness circles of the search for meaning, the meaning or purpose in life, and the meaning triangle. Was within the context of the situational and existential meaning and or the ultimate meaning or meaning of the moment. And lastly, meaning evocation as a consequence included meaning interpretation, analysis, and understanding, which led to the formulation of meaning-based approaches. Next slide, please. So I know that some of the concepts may be um, repeated, a lot of them about meaning. So let me illustrate this as a model case. So whenever we are developing concepts, you always relate it as a model case to understand its use in the um, clinical setting. So let me illustrate it this way. Carmen is a 68-year-old Asian mother of four children, two girls and two boys. She's been battling cancer for the last 15 years. It started as a breast lump to which she had mastectomy. After 5 years, the doctor found a metastasis in her left lung to which she had lobectomy. For a while, the doctors told her that she was cancer free until she felt pain in her hips and knees. She consulted the doctor thinking it is some form of arthritis, but they found metastasis in her bones. At this time, two of her children were getting married and the other two are graduating. Carmen was never more eager to get better. She wanted to be present during these milestones and be with her children. This prompted her to decide for chemotherapy treatments to which she had severe side effects: fainting, nausea, vomiting, and alopecia. Her husband Tony retired from work to take care of her, always at her side throughout the ordeal. Next slide, please. After cycles of chemo treatment, the doctor told Carmen that the cancer is on remission. She breathed a sigh of relief, saying, "This is what it meant to have a second chance in life." She thanked her husband and her children for their support, telling them that she do not want to go through this whole ordeal ever again. She does not understand the meaning of this suffering. Until one day, Carmen had blurring vision and severe headache. A visit to the optometrist tells them that she does not need new eyeglasses but must see another doctor, an oncologist. The oncologist tells the family that Carmen's magnetic resonance imaging, or MRI, shows brain metastasis and asks them if they would like to be the one to break the news to her. So Tony had a meeting with his children, telling them not to inform their mother that her cancer has metastasized to the brain. He said to leave her at peace with the notion that she will be all right and would get better soon. So when Carmen asked about her condition, her husband and children reassured her that she was going to be fine. Next slide, please. Her significant others knew that bone and brain cancer had poor prognosis. According to them, it is the least they could do to make sure that Carmen maintains a worry free state of mind. However, the family were not prepared that Carmen would be in severe pain because of bone cancer. She wailed in pain all day long. The doctor was cautious to give her pain relievers for fear that she could have drug induced coma. Carmen said the pain meant that she was severely sick, but she could not understand why her husband and children tells her otherwise. As she feels weaker by the day, she knows she is slipping away from her loved ones. Barely awake but every inch in pain, Carmen recalls the pain now meant she is still alive and able to live another day with her loved ones. Every pain evoked the promise that she will get better. But Carmen went into coma and died in her sleep. Next slide, please. So as we can see from the model case, it in the antecedents, we can hear Carmen saying, "This is what it meant to have a second chance in life. which showed the meaning of the experience to her. The situation showed the love and support given by her husband and children. However, because of this love for them and not wanting them to suffer, Carmen does not want to go through the same ordeal again for herself and for the sake of her loved ones. Next slide, please. For the attributes, meaning can be widely perceived as situational meaning or meaning of the moment, such that when Carmen said the pain meant that she was severely sick, but she could not understand why her husband and children tells her otherwise. These are signs or symbols expressing that what was valuable for Carmen's family. It seems that Tony placed a change in attitude, meaning he values a more positive approach towards Carmen's illness. This was perhaps because Tony knew that Carmen values their family. He knows that her meaning or purpose in life is to fulfill the future hopes of her children and be there for them. Tony remembered that when they first found metastasis in her bones, their children are getting married and graduating. This made Carmen to be the more eager to get better. She wanted to see these milestones with her children. She decided to have chemotherapy treatments then because she wanted to be there when her children fulfills their lifelong goals and ambitions. Next slide, please. However, in Carmen's search for meaning, she was reoriented to look into her past, present, and to the future, and she was forced to do some dereliction. In this process, she finds the ultimate meaning of life, or the meaning of her existence, is to be there for her family, the one thing she valued most. Meaning can be attributed as a value system. And existential meaning, as it was understood in contemporary existentialism and logotherapy, was the way people put meaning into their universal existence. The meaning of life was a notion concerning the value of human existence. In the end, when Carmen barely awake, but every inch in pain, she recalls that the pain now meant she is still alive and able to live another day to be with her loved ones. Every pain evoked the promise that she will get better and continue to exist in this world. Next slide, please. So, as a consequence, once the meanings were evoked, meanings are interpreted and analyzed and understood. These are components to the formulation of meaning based approaches, including a basis for meaning based nursing care. Pragmatics revealed that meaning was both something affected by and affecting the world. Meaning was something contextual with respect to language and the world, and was also something active towards meanings in the world. Meaning understanding include culture, experience, dissonance, and even literal meaning. To understand Carmen, her culture states the main value of an Asian mother is to be a homemaker, to look after her husband and children. Culturally, her needs take a backstand with the goals and ambitions of her family. This means to care for her is to care after the needs of her family. That will create her dissonance or inner harmony. Next slide, please. So, as a consequence, Carmen once said she sensed there was something wrong with her health, but her family telling her otherwise means, as interpreted, that she gives full trust in her family. Even though a sensory input created by a stimulus cannot be articulated in language or signs of any kind, it can nevertheless have a meaning. However, even if her intuition says so, she held on to the belief that every pain evoked the promise that she will get better. This can be experimentally demonstrated by showing that people behaviorally respond in specific, non arbitrary ways to sensing a stimulus consciously or subconsciously, even although they have no way of telling what it was or means, or no possible way of knowing what it was or what it means. Next slide, please. So, thus, being meaning based means to treat the patient with dignity and to respect the patient's personhood, including their innate feelings. The nurse's interventions to be meaning based must carry the core values of compassion and meaningful empathic regard towards patients. And the inclusion of meaning based nursing care in the training of future nurses was essential to develop compassionate nurses with respect for the dignity and personhood of patients with personalized provenance. Next slide, please. So, what have we learned about meaning based nursing care? So far, we have learned to understand that meaning based nursing care is grounded on the belief that nurses can enhance and facilitate wellness by supporting and accommodating the meanings that are attached to a person's experience. The interactions of the nurse with the patients create the meaning based nursing care. And being meaning based for a nurse is to treat the patient with dignity and respect and to respect the patient's personhood. So, being meaning based is all about who you are and how you treat the patient, and respond to the meaning of the experiences the patients have. Next slide, please. What are in meaning based nursing care? As a basis for discussion on meaning based nursing care was centered on the ability of the nurse to find meaning that is essential to being meaning based. The nurse builds her nursing care on meanings attached to the personalized experience of patients. So it requires that we add an assessment on meaning when we tailor fit our individualized nursing care plans. To emulate the Filipino trait of malasakit, malas meaning to see or ipamalas or ipakita, and then sakit or sakit, which means pain. Malasakit means to see the pain of others. This is a Filipino trait which enlivens meaning based nursing care. Most Filipino nurses go the extra mile to address the meaning of experiences and situations to patients that they encounter. It's like seeing how the pain has um, caused the patient to become who they are. So, um, malasakit is a cultural trait that is very uniquely Filipino and much loved and sought after as a trait for nurses. Next slide, please. So, the Filipino cultural context of meaning based care is about, aside from pagiging may malasakit, is about pagiging malambing or has the ability to charm patients as a way of establishing rapport. In all formal care situations, the basis of care is centered in the ability of nurses to form rapport with the patient. The relationship is deemed to be therapeutic in that it is based on mutual respect, trust, tolerance, understanding, and even friendliness, as most relationships are based on. This is a professional really this is a professional relationship requiring attention, as nurses are expected to invest time and effort into making it succeed as part of their normal duties. The meaning-based nursing care mentioned in this presentation is recommended to nurses as a means to stay committed to the nurse-patient relationship and to provide avenues for interaction that illuminate the meanings of persons and the nurse's experiences. The integration of meaning-based nursing care in nursing situations will guide nurses to create meaningful interactions that address the needs of the patient's mind, body, and spirit. Next slide, please. So, like what I was sharing with you earlier, I had a chance to check this in the meaning-based nursing care in the clinical setting, asking nurses and patient what being meaning-based means for them. So when a person experienced pain and discomfort, meaning-based nursing care was categorized into situational meaning or meaning of the moment and existential meaning or meaning of life. The nurses and patients in the study of Cuevas in 2007 explicated clear approaches on how it should be done. So, as I mentioned earlier, it is something that can be prescribed in the clinical setting. And these are narratives of patients and nurses on how it can be done. Nurses render situational, meaning based nursing care by the following: by giving medications as soon as necessary. These are for PRN medications. Like when a patient complains of pain or fever, they will be there um, as soon as it's necessary, not taking time to give the PRN meds. Encouraging deep breathing exercises, giving advice on diversional activities, application of therapeutic regimen like cold or warm compress is necessary, and rendering other comfort measures like giving a soft pillow or warm milk. If we get to think about it, these are really nursing interventions that we've always been doing. This is something that we've always done before. The findings of these studies really just telling us, no, that this is something that patients and nurses appreciate and should still be replicated in future settings. Next slide, please. Likewise, nurses render existential meaning based nursing care by the following: providing care and support through enhancing patients' belief in God. This is not necessarily a religious thing or something for one particular religion, but to God in general. And spiritual care and support means um, enlivening the faith in God of patients when they are hospitalized or experiencing their symptoms. Encouraging family involvement in the care of the patient. Um, Instead of being strict with visiting hours, making sure that family is involved not only physically but also in decision making um, would help, patients in existential meaning-based care. Using therapeutic touch during nurse-patient interactions, or if not applicable, any physical contact applicable to be given by the nurse to the patient. This was said to be something related um, to the warmth of the touch or the sense of connectedness of the patient and the nurse. No? Any form of touch would actually render um, connectedness between the dyad, and it's very much meaningful, especially for the patient. Encouraging verbalization of feelings with nonverbal show of support like active listening or being there for the patient, spending time with the patient. We don't really realize it as much, but um, our nonverbal cues are very important, like the way we slowly walk or how we quietly talk. Those are very important. I have even had narratives of patients telling me that um, the smell of the nurse makes them feel better, or the presence of the nurse is enough to make them feel that someone will be there to care for them. These narratives are so important because it's very meaningful and it's very meaning laden. Also, giving verbal show of support, giving hope through verbal communication. No, it's like saying, this is something that maybe um, will make you stronger, something you can get through. Giving other alternative nursing care modalities are also important, like therapeutic massage or aromatherapy. I remember the theory of Jean Watson telling us there are a lot of alternative nursing care modalities that we can um, em- use, no, interventions that we can share in the clinical setting to make the patients feel better. And if there's a chance to do so, let us do so. Next slide, please. So, meaning based nursing care plans require that nurses stay committed to the nurse patient relationship and to make provisions or for avenues of diet interaction that illuminate the meaning of the patient and the nurse experiences. The integration of meaning-based nursing care among individualized care plans can guide nurses to create meaningful interactions that will address the needs of a patient's mind, body, and spirit. And nurses treat patients as holistic beings and offer them alternative nursing care modalities. By doing so, this means they deliver meaning-based nursing care. Next slide, please. So nurses do these approaches in giving meaning-based nursing care and caring created uplifting effects for patients involved in the caring interaction. Um, they actually feel being respected, feel they belong, personal growth, personal transformation, and wanting to learn to care and the desire to care. Next slide, please. So when nurses were asked to do a self-reflection of meaning-based nursing care, when in persons with pain and discomfort, the following response is what it means for nurses. So giving prompt response when called, no? So being there for them when they need you, listening to the patient when they talk to the nurse, and this means really listening, not just hearing the patient, showing of being service oriented, showing efficiency at work. Imagine if you're efficient at work, it really means that you care for the patient because you can serve more people at a short amount of time. Encouraging reciprocity, encouraging to show your to show them how they feel and how you feel about them, showing trustworthiness and reliability. No? Very recently, the nurses again hailed as the most trustworthy profession, no? And we should be proud of that. Conveying genuine concern to our patients is meaning-based nursing care. Next slide, please. Also, therapeutic use of self. No? We can give open-ended questions, allow the person to verbalize their feelings, and then giving presence when needed. No? Sometimes you just need to be there for them when they talk, or be there for them when they speak with their family, easing painful situations like physical and psychological, demonstrating signs of relief, seeing the self with a clear mission. The nurses also said being meaning based is showing virtue and embodying the care that you render. No? So these are the ways to be meaning based in giving your nursing care. Next slide, please. So also, the nurses said that to be meaning based is to give prompt response, means being at their side within 5 minutes of a call. So it means there is a time frame or a time element that is quick enough for you to be meaning based. Fostering communication about needs means talking to them whenever the nurse approaches. No? So sometimes there's a need to be quiet, but most of the time there's a need to speak up. No? And never think that common sense is common for everyone. No? There's no such thing. You should be able to say what you mean. And then showing efficiency at work means being service oriented and caring for their welfare. Encouraging reciprocity means giving encouraging words, praising good and healthy actions, giving positive reinforcement, and giving hope to the patient. Next slide, please. Showing trustworthiness means being reliable with congruence of words and actions. So, walk your talk. No? Say what you mean, or whatever it is that you say, you should, mean it within a reasonable time frame. Conveying concern and to use self therapeutically means giving the gesture of smiling, a pat at the back, giving a hug or a short embrace, giving a hand squeeze when necessary, giving gentle words of encouragement, using soft, calm voice when talking to individual patients. So these are something really easy that we can replicate in this setting, no? Especially for patients that are older adults. No? They would require our more of our love and attention. No? Next slide, please. We can also do stroking the hand of the patient when in pain or anxious. Giving constant presence when needed means staying beside the person, but talking in front of them. So beside staying beside the person, but talking in front of them, not talking while we're at their back, or at their foot part. Now, there's a certain um, area that they want us to be. And then generating comfort in a calm environment means spending time with your patient, showing no irritation to complaints, and demonstrating signs of relief. Telling them, oh, you're getting better. Oh, now you can stand. Now you can do this. That actually encourages them a lot. So, next slide, please. Seeing the nurse as someone with a special mission means giving spiritual care and support regardless of religious belief and orientation. Furthermore, it means encouraging the patient to pray and enhancing the patient's belief in God. Showing virtues and the embodiment of nursing care rendered means may malasakit or going the extra mile to give nursing care. No, and that's a trait that can be replicated. Next slide, please. So what impact will the definition have now that we have clearly defined meaning-based nursing care? So the impact of clearly defining the concept of meaning-based nursing care was to prescribe this intervention to patients who search for meaning in illness, disease, suffering, or life itself. Furthermore, this will open the channels of communication between the patient and the nurse to discuss vital issues related to finding and addressing meaning to patients in any nursing situation. Next slide, please. In conclusion, the awareness of meaning was and can be very elusive and context dependent. However, nurses have the unique task of walking with the patient in this journey to finding meaning in life. Thus, the nurse was given this rare opportunity and challenge to help patients to discover the meaning in life experiences, whether in the occurrence of symptoms or not. Thus, nurses must stay committed to being meaning based in approaching the nurse patient relationship. Being meaning based means to provide avenues for interactions that illuminate meaning of patients' experiences and creating approaches that provide holistic nursing care to address the needs of patients' mind, body, and soul. Next slide, please. Okay, so these are my references. Um, there are a lot of this actually in the next slides, and these slides will be available at the Sigma repository or the Virginia Henderson e-repository, and you can look at the slides, you can access the slides and my references through the e-repository. Thank you very much for attending this session, and good day to everyone.
Thank you so much, Dr. Cuevas. This has been wonderful. And I do have to say we have several questions, but we are out of time today. So how can these participants connect with you to get their questions answered? Do you want them
You
to email you or LinkedIn, or what's the best way?
Thank you, Linda. They can email me. I have my email address at Sigma, or they can connect with me at the Sigma Circle.
Okay, perfect. And is it okay if we put your email address in the chat feature for everyone?
Yes, that would be wonderful. Thank you.
Yeah, of course. Thank you so much. We're getting wonderful responses of everyone saying your presentation was wonderful, and they're eager to view the PowerPoint when it's loaded onto the Sigma repository. Thank you for this great information. We are grateful that you took time to share with the audience today. We look forward to hearing more from you in the future, Pearl. We hope that you have enjoyed this webinar. As a reminder, 1 week from today, we will email the link to the evaluation for you to obtain your Nursing Continuing Professional Development Certificate. Be sure to check out Sigma's upcoming webinars and resources to support you and your colleagues at sigmanursing.org. Also, previously recorded webinars are freely available on the Sigma repository. Thank you so much for joining us today. I'll go ahead and put Dr. Cueva's email address in the chat feature if you want to connect afterwards. Have a lovely day.